My name is Sarah, and I'm about to tell you the story of how I got my revenge on the most arrogant surgeon in the entire hospital. Not with words, not with complaints to administration, but with something far more powerful. Pure, unshakable competence. This is the story of how my first week as a surgical nurse became the day I proved that sometimes the newest person in the room sees what everyone else misses, and how that moment of clarity saved a life and destroyed an ego forever. It was Monday morning, 7:15 a.m., and I was standing outside operating room 3, my hands trembling slightly as I adjusted my surgical cap for the third time. Fresh out of nursing school, my knowledge was sharp, my protocols memorized to perfection. But my confidence was still finding its footing in the intimidating world of the OR. The hallways of St. Mary's Hospital buzzed with the controlled chaos of morning prep, and I could hear the familiar sounds of surgical instruments being arranged, monitors being calibrated, and the low murmur of experienced professionals discussing the day's cases. I had been assigned to work with Dr. Marcus Hayes, a cardiovascular surgeon with a reputation that preceded him like a storm cloud. At 45, he was considered one of the most skilled surgeons in the region, with hands that could navigate the most complex procedures and a success rate that had made him something of a legend. But legends, I was about to learn, often come with a price, and that price was usually paid by everyone around them. Dr. Hayes was known for his perfectionism, his demand for absolute precision, and his complete intolerance for anything he perceived as incompetence. The other nurses had warned me about him during my orientation week. "He's brilliant," they said, "but he has no patience for mistakes, no tolerance for hesitation, and absolutely no understanding of what it's like to be new." They told me stories of nurses who had been reduced to tears, of residents who had been humiliated in front of entire surgical teams, and of how Hayes had once thrown a surgical instrument across the room because someone had handed him the wrong size clamp. But I was determined to prove myself. I had graduated at the top of my class. I knew every protocol by heart, and I was committed to following every safety measure to the letter. My instructors had drilled into us that in the OR, there are no shortcuts, no assumptions, and no room for ego when patient safety is at stake. Every instrument had to be counted, every step had to be verified, and every decision had to be made with absolute certainty. The first 3 days of that week had been a careful dance of trying to anticipate Dr. Hayes' needs while maintaining my commitment to proper procedure. I had watched him work, studying his techniques, learning his preferences, and trying to read his moods. He was undeniably skilled, his movements precise and confident, but there was an underlying tension in every interaction, a sense that he was constantly evaluating everyone around him and finding them lacking. On Wednesday morning, during a routine gallbladder removal, I experienced my first real encounter with Hayes' legendary temper. He had requested a particular clamp, and I had reached for it, but then paused to double-check the instrument count as my training required. It was a safety protocol, a simple verification that took maybe 3 seconds, but to Hayes, those 3 seconds were an eternity of incompetence. "What are you doing?" he had snapped, his voice cutting through the sterile air of the OR like a scalpel. I asked for the clamp, not a dissertation on surgical instruments. I had quickly handed him the clamp, my cheeks burning with embarrassment, but he wasn't finished. "Listen, nurse," he had continued, his eyes never leaving the surgical field. "In my OR, when I ask for something, I expect it immediately. Your job is to anticipate my needs, not to second-guess every decision. If you can't keep up with the pace of real surgery, maybe you should consider a different specialty." The other members of the surgical team had exchanged glances, but no one had spoken up. This was Hayes' domain, and everyone knew better than to challenge him during a procedure. I had felt my face flush with humiliation, but I had also felt a spark of something else: determination. I knew I had been following proper protocol, and I knew that patient safety should never be compromised for the sake of speed or ego. After that incident, I had made a decision. I would be faster, more efficient, but I would never compromise on safety. I would prove that thoroughness and speed weren't mutually exclusive, that a new nurse could be both careful and competent. I spent my evenings reviewing procedures, memorizing instrument layouts, and practicing my movements until they became second nature. By Thursday, I thought I was making progress. I had successfully anticipated most of Hayes' requests. I had maintained my safety protocols without causing delays, and I had even received a grudging nod of approval when I had correctly identified a potential complication before he had noticed it. But I was about to learn that in the world of surgical egos, progress is often just the calm before the storm. Friday morning arrived with the promise of a routine day. The schedule showed a standard cardiac catheterization procedure, something Hayes had performed hundreds of times. The patient was a 58-year-old man named Robert Chen, a father of 3 who had been experiencing chest pain and shortness of breath. His cardiac enzymes were elevated, and the catheterization would help determine if he needed bypass surgery or if his condition could be managed with medication and lifestyle changes. I had arrived early, as was my habit, to review the patient's chart and prepare the OR. Robert Chen's case seemed straightforward enough. No major complications in his medical history, no unusual allergies, and no red flags that would suggest potential problems. His preoperative labs were within normal limits. His EKG showed some minor abnormalities, but nothing alarming, and his chest X-ray was clear. Dr. Hayes entered the OR at exactly 8:30, his usual time. Moving with the confidence of someone who had performed this procedure so many times it had become routine. The rest of the team was already in place. Dr. Sayoom, Jennifer Martinez, the anesthesiologist, was monitoring the patient's vital signs. Tom Bradley, the surgical tech, was arranging instruments, and Lisa Wong, the circulating nurse, was documenting the pre-procedure checklist. "Good morning, everyone," Hayes said, his voice carrying the authority of someone accustomed to being the center of attention. "Standard catheterization today should be straightforward. Mr. Chen's case is textbook simple, so let's keep this moving efficiently." He glanced at me, and I saw that familiar look of evaluation in his eyes. "Nurse Sarah, I trust you're ready to keep up today? No unnecessary delays, no second-guessing, just efficient professional assistance." I nodded, feeling the familiar flutter of nervousness mixed with determination. "Yes, Dr. Hayes, I'm ready." The procedure began exactly as planned. Dr. Martinez had successfully intubated Mr. Chen, and his vital signs were stable. Hayes made the initial incision in the patient's groin, exposing the femoral artery where the catheter would be inserted. His movements were smooth and practiced, each cut precise and deliberate. "Catheter," he requested, and I handed it to him immediately. Our timing synchronized perfectly. He threaded the thin tube into the artery, guiding it toward the heart using fluoroscopic imaging. The monitors showed the catheter's progress as it moved through the patient's vascular system, and everything appeared to be proceeding normally. But as Hayes began to navigate the catheter through a particularly narrow section of the coronary artery, something went wrong. The fluoroscopy screen showed a sudden change in the contrast dye pattern, and the patient's blood pressure began to fluctuate. What should have been a routine threading of the catheter had become something much more serious. "What the hell?" Hayes muttered, his confidence wavering for the first time since I had known him. The catheter had apparently perforated the artery wall, creating a small tear that was now bleeding into the surrounding tissue. It was a known complication of the procedure, but one that required immediate and precise intervention. The monitors began to alarm as Mr. Chen's blood pressure dropped and his heart rate increased. "Dr. Said," Martinez looked up from her anesthesia station, her expression immediately alert. "We're seeing signs of internal bleeding," she announced, her voice calm but urgent. "BP is dropping. Heart rate is climbing." Hayes's demeanor changed instantly. The smooth confidence was replaced by a barely controlled panic, and I could see sweat beginning to form on his forehead, despite the cool temperature of the OR. This was not the Hayes I had observed during routine procedures. This was a man facing a complication that threatened not just his perfect record, but a patient's life. "Get me suction," he barked, his voice sharp with stress. "I need better visualization of the field." Tom handed him the suction catheter, but Hayes was struggling to locate the exact source of the bleeding. The contrast dye was obscuring his view, and the patient's blood pressure continued to drop. Every second that passed increased the risk of permanent damage or death. "More suction," Hayes shouted, his usual controlled tone replaced by something approaching desperation. "I can't see anything with all this blood." I watched the monitors carefully, noting the pattern of the patient's vital signs. My recent training in emergency protocols was fresh in my mind, and I could see indicators that suggested the bleeding was coming from a specific area of the coronary artery. But Hayes was so focused on the immediate crisis that he seemed to be missing the bigger picture. "Dr. Hayes," I said quietly, trying to get his attention without disrupting his concentration. "The patient's central venous pressure is—" "Not now," he snapped, not even looking up from the surgical field. "I need to focus on stopping this bleeding, not listen to observations from someone who's been doing this for all of 5 minutes. The rebuke stung, but I could see that Hayes was making a critical error. His panic was causing him to focus too narrowly on the immediate problem instead of considering the broader pattern of symptoms. The patient's vital signs were telling a story, and that story suggested that the bleeding was not where Hayes was looking.
Lisa Wong, the circulating nurse, moved closer to the table, ready to assist with whatever Hayes might need. Tom was preparing additional instruments, anticipating that this simple procedure was about to become a major surgical intervention. Dr. Martinez was adjusting medications, trying to maintain the patient's blood pressure while Hayes worked to control the bleeding. But Hayes was losing control of the situation.
His hands, usually so steady and precise, were beginning to shake slightly as he struggled to locate the source of the bleeding. The fluoroscopy screen showed contrast dye spreading through the patient's chest cavity, indicating that the perforation was larger than initially thought. "This is impossible," Hayes muttered, his voice barely audible above the alarm of the monitors. "The bleeding should be right here, but I can't locate it." I looked at the monitors again, studying the pattern of vital signs and the fluoroscopic images. My textbook knowledge was screaming at me that Hayes was looking in the wrong place, that the bleeding pattern suggested a different location entirely. But how could I, a nurse with less than a week of experience, challenge the judgment of one of the hospital's most respected surgeons? The answer came when Mr. Chen's blood pressure dropped to a dangerously low level, and Dr. Martinez announced that they were approaching the point of no return. "We need to get this under control immediately," she said, her voice carrying the weight of years of experience. "We're running out of time." Hayes looked up from the surgical field, his eyes wild with panic and frustration. For the first time since I had known him, he looked uncertain, vulnerable, and completely out of his depth. The arrogant surgeon who had humiliated me just days earlier was now facing the possibility of losing a patient due to his own inability to control a complication. He began, then stopped, his voice trailing off as he realized he didn't know what he needed. The bleeding was continuing, the patient's condition was deteriorating, and Hayes was paralyzed by the magnitude of his failure. That's when I made a decision that would change everything. Despite my inexperience, despite the hierarchy of the OR, despite the risk of being humiliated again, I knew I had to speak up. The patient's life was more important than my ego, more important than Hayes' reputation, and more important than the unwritten rules of surgical authority. "Dr. Hayes," I said, my voice stronger than I felt, "I think the bleeding might be coming from the subclavian branch, not the main coronary artery." Hayes looked at me with a mixture of disbelief and rage. Here he was, facing the crisis of his career, and a novice nurse was presuming to diagnose the problem. The audacity of my suggestion seemed to push him over the edge. "Are you seriously trying to tell me how to do my job?" he shouted, his voice echoing through the OR. "You've been here for less than a week, and you think you can diagnose arterial bleeding better than someone who's been doing this for 20 years? But I couldn't back down. Not when I could see the patient's vital signs continuing to deteriorate. Not when my fresh knowledge from school was telling me exactly what the problem was. Not when a man's life hung in the balance. The pressure readings and the contrast pattern both suggest," I began. "Get her out of the OR!" Hayes screamed, his voice raw with fury and desperation. "I will not have some inexperienced nurse questioning my judgment during a crisis. Get her out of here now!" The words hit me like a physical blow. The entire surgical team froze, and I felt my cheeks burn with the intensity of the humiliation. Lisa Wong moved toward me, clearly intending to escort me out of the OR as Hayes had demanded. In that moment, I felt smaller than I had ever felt in my life, reduced to nothing more than an obstacle to be removed. But as I turned to leave, something made me look back one more time at the monitors, at the fluoroscopic screen, at the pattern of bleeding that was so clear to me, but invisible to Hayes in his panic. My training kicked in, overriding my embarrassment and fear. I had spent 4 years studying for this moment, memorizing every protocol, every emergency procedure, every possible complication. And in that split second of clarity, I saw it. The bleeding wasn't coming from where Hayes was looking at all. The subclavian artery had been nicked during the initial catheter insertion, and the tear had been obscured by the patient's anatomy. It was a textbook complication, one that every nursing student learned about, but one that was easy to miss in the chaos of an emergency. I stopped walking toward the door and turned back to face the surgical table. My heart was pounding, my hands were shaking, but my voice was steady when I spoke. Dr. Hayes, the subclavian artery is retracted behind the pectoralis muscle. That's why you can't see it on the fluoroscopy. The OR fell completely silent, except for the persistent alarms of the monitors. Hayes looked at me with an expression I had never seen before. A mixture of rage, desperation, and something that might have been hope. "What did you say?" he asked, his voice barely above a whisper. I took a deep breath and stepped closer to the table. "The bleeding is coming from a tear in the subclavian artery, but it's retracted behind the muscle tissue. That's why the contrast dye pattern looks like it's coming from the coronary circulation. If you adjust the fluoroscopy angle by about 15 degrees and look posterior to the pectoralis insertion, you should be able to see it." For a moment that seemed to last forever. Hayes stared at me. Then, without a word, he adjusted the fluoroscopy machine exactly as I had suggested. The screen flickered, the angle changed, and suddenly the source of the bleeding was clearly visible. "Jesus Christ," Hayes whispered, his voice filled with a mixture of relief and disbelief. "There it is." He immediately began working to control the bleeding, his hands regaining their steady precision now that he could see what he was dealing with. The torn artery was exactly where I had said it would be, hidden behind the muscle tissue but clearly visible from the adjusted angle. Within minutes, Hayes had successfully repaired the tear and controlled the bleeding. Mr. Chen's vital signs began to stabilize, his blood pressure started to rise, and the crisis was over. The patient who had been minutes away from death was now stable and recovering. As the immediate danger passed, the reality of what had just happened began to sink in. A first-week nursing student had diagnosed a complication that had stumped one of the hospital's most experienced surgeons. The novice had saved the patient while the expert had been paralyzed by panic. Hayes completed the procedure in silence, his movements mechanical and precise but lacking the confident swagger I had come to associate with him. When he finally stepped back from the table, he looked at me with an expression I couldn't quite read. "Thank you," he said quietly, so quietly that I almost didn't hear him. But I had heard him, and more importantly, so had everyone else in the OR. The surgeon who had never thanked anyone for anything, who had built his reputation on the assumption that he was always the smartest person in the room, had just acknowledged that a novice nurse had seen something he had missed. The rest of the surgical team began the process of closing the procedure and preparing Mr. Chen for transport to the recovery room. Dr. Martinez was adjusting his medications to ensure a smooth awakening from anesthesia. Tom was counting instruments and cleaning the surgical field. Lisa was documenting the procedure and the complications that had occurred. But I was still standing there, trying to process what had just happened. In the space of a few minutes, I had gone from being humiliated and dismissed to being the person who had saved a patient's life. The knowledge I had gained from textbooks and lectures, the protocols I had memorized, the careful attention to detail that Hayes had criticized as slowness, all of it had come together in that crucial moment. As Mr. Chen was wheeled out of the OR and into recovery, Hayes removed his surgical gloves and mask. He looked older than he had when the day began, as if the events of the morning had aged him in ways that went beyond mere time. "Nurse Sarah," he said, his voice formal but lacking its usual edge. "I need to speak with you." I followed him to a quiet corner of the OR, my mind racing with possibilities. Was he going to reprimand me for not following his order to leave? Was he going to report me for insubordination? Or was something else entirely about to happen? "What you did today," he began, then stopped, seeming to struggle with the words. "What you saw, what you diagnosed, that was exceptional clinical judgment. I've been doing this for 20 years, and I missed something that you caught immediately." He paused, and I could see that admitting this was difficult for him. His entire identity was built on being the expert, the one who knew more than anyone else in the room. Having that challenged, especially by someone so new, was clearly a painful experience. "I owe you an apology," he continued. the words coming slowly as if each one was being carefully considered. "I was wrong to dismiss your observations, and I was wrong to try to have you removed from the OR. Your attention to detail, your knowledge of anatomy and physiology, your ability to see the bigger picture, those are exactly the qualities that make a great surgical nurse." I stood there, barely believing what I was hearing. This was the same man who had humiliated me, who had questioned my competence, who had screamed at me in front of the entire surgical team. And now he was apologizing, acknowledging that I had been right and he had been wrong. "Thank you, Dr. Hayes," I said, not sure what else to say. He nodded, then looked at me with something that might have been respect. "I'd like you to continue working with my surgical team, if you're willing. I think I could learn a few things from your approach to patient care." And that's how my revenge was complete. Not through anger or retaliation, not through complaints or confrontation, but through competence. I had proven that knowledge and careful attention to protocols could triumph over experience and ego. I had shown that sometimes the newest person in the room sees things that everyone else misses. You know what's funny about this whole story? I never set out to get revenge on Dr. Hayes. I never planned to humiliate him or prove him wrong. All I wanted was to do my job well, to follow my training, and to provide the best possible care for my patients. But sometimes, when you stay true to your principles and trust in your knowledge, revenge finds you. If you're enjoying this story of how competence conquered arrogance, make sure to subscribe to Hospital Revenge for more incredible tales of medical justice. We share stories of how the underdogs, the newcomers, and the overlooked professionals prove that knowledge and dedication can overcome any obstacle. Hit that subscribe button and join our community of medical professionals who believe that patient care comes first, always. The weeks that followed were unlike anything I had expected when I first started working at St. Mary's Hospital. Word of what had happened in OR3 spread quickly through the hospital, as medical stories always do. But the story that circulated wasn't about an arrogant surgeon being humiliated by a novice nurse. Instead, it became a story about the importance of fresh perspectives, about how new graduates bring valuable knowledge that complements the experience of veterans. Dr. Hayes, to his credit, completely changed his approach to working with new staff. He began actively seeking out the observations and suggestions of residents and nurses, recognizing that their recent education often included the latest protocols and techniques. He started what he called Fresh Eyes Rounds, where he would specifically ask newer team members to review cases and share their perspectives. Our working relationship evolved into something I never could have imagined. Hayes became not just a colleague, but a mentor who valued my input and encouraged my professional development. He recommended me for advanced training programs, included me in complex cases, and even asked me to present at medical conferences about the importance of interdisciplinary communication in the OR. But the most important outcome was the change in how our entire surgical department approached teamwork and communication. The incident had highlighted how quickly a crisis could escalate when ego and hierarchy got in the way of patient care. New protocols were implemented that encouraged anyone on the surgical team to speak up if they noticed something concerning, regardless of their position or experience level. Mr. Chen made a full recovery, completely unaware of how close he had come to a very different outcome. When I visited him in his room a few days after the surgery, he thanked me for taking such good care of him. He had no idea that his life had been saved, not by the famous surgeon, but by the newest nurse on the team. 6 months later, I was working alongside Dr. Hayes on a complex cardiac surgery when a similar complication arose. This time, when I noticed something unusual in the patient's vital signs, Hayes immediately stopped what he was doing and asked for my assessment. We worked together to identify and resolve the issue, and the patient never experienced any of the life-threatening complications that had occurred with Mr. Chen. "You know," Hayes said to me after that surgery, "I've been thinking about what happened that day in October. I realize now that my reaction wasn't just about being questioned by a new nurse. It was about being forced to confront the fact that I had become complacent, that I had stopped seeing each patient as a unique individual with unique challenges." He paused, removing his surgical gloves with the same precise movements I had come to associate with him. "Your fresh perspective reminded me why I became a surgeon in the first place. Not to be the smartest person in the room, but to provide the best possible care for every patient, every time." That conversation marked the beginning of a new chapter in both of our careers. Hayes became an advocate for mentorship programs that paired experienced surgeons with new graduates, creating opportunities for knowledge sharing that benefited everyone involved. I became involved in developing training protocols that emphasized the importance of speaking up when patient safety was at stake. Looking back on that day now, I realized that the real lesson wasn't about revenge or proving someone wrong. It was about the importance of staying true to your training, trusting your knowledge, and never letting hierarchy or intimidation prevent you from advocating for your patients. The medical field is built on a foundation of continuous learning, where new research and techniques are constantly evolving. Veterans bring invaluable experience and judgment, but newcomers bring fresh knowledge and perspectives that can be equally valuable. The best outcomes happen when these different strengths are combined, when ego takes a back seat to patient care, and when everyone on the team feels empowered to contribute their expertise. I've now been working at St. Mary's Hospital for over 2 years, and I've had the opportunity to mentor new nurses who are just starting their careers. I always tell them the same thing. Trust your training, follow your protocols, and never be afraid to speak up when you see something that concerns you. Your fresh perspective is not a weakness. It's one of your greatest strengths. The story of that day in OR3 has become something of a legend at our hospital, but not in the way you might expect. It's not told as a story of revenge or humiliation, but as a reminder of how quickly things can change when we're willing to listen to each other, to learn from each other, and to put patient care above all else. Dr. Hayes and I continue to work together regularly, and our professional relationship has evolved into something that I treasure. He's taught me countless surgical techniques, shared his vast experience with complex cases, and helped me develop the clinical judgment that can only come from years of practice. In return, I've helped him stay connected to the latest developments in nursing protocols, evidence-based practice, and patient safety research. We've presented together at medical conferences, co-authored papers on interdisciplinary teamwork in the OR, and developed training programs that are now used in hospitals across the country. Our story has become an example of how conflict can be transformed into collaboration when both parties are willing to learn and grow. But perhaps the most satisfying part of this whole experience has been the impact on patient care. The protocols we developed, the communication strategies we implemented, and the culture change we helped create have led to measurably better outcomes for patients. Surgical complications are down, patient satisfaction scores are up, and the overall morale of the surgical team has improved dramatically. If you're loving this story of how knowledge triumphed over arrogance, how a newcomer's fresh perspective saved a life, and how conflict was transformed into collaboration, make sure to hit that like button and leave a comment telling us about your own experiences with workplace challenges. Have you ever had to stand up for what you knew was right, even when it meant challenging someone with more experience or authority? We'd love to hear your stories of professional courage and vindication. The real victory in this story isn't that I proved Dr. Hayes wrong or that I got my revenge on someone who had humiliated me. The real victory is that a patient's life was saved, that a toxic workplace culture was transformed, and that 2 professionals learned to work together in a way that made both of them better at their jobs. This is the kind of revenge that matters. Not the petty satisfaction of seeing someone fail, but the profound fulfillment of knowing that you stayed true to your principles, trusted your knowledge, and ultimately made a difference in someone's life. It's the revenge of competence over arrogance, of humility over ego, and of teamwork over hierarchy. In the end, the best revenge is not revenge at all. It's excellence. It's professionalism. It's the quiet satisfaction of knowing that you did the right thing, even when it was difficult, even when it was scary, even when it meant risking your own comfort and security to advocate for someone else. That's the lesson I learned in OR3 on that October morning, and it's a lesson that has guided every decision I've made since then. Trust your training, speak up for your patients, and never let anyone convince you that your knowledge and perspective don't matter. Sometimes the newest person in the room is exactly who everyone needs to listen to. The story of how a first-week nurse spotted what an experienced surgeon missed has become more than just a tale of medical drama. It's become a teaching tool, a reminder of why we do what we do, and an inspiration for anyone who has ever felt intimidated by hierarchy or discouraged by criticism. Every time I walk into an OR now, I remember that moment when I had to choose between my comfort and my patient's life. I remember the fear I felt when I challenged Dr. Hayes, the humiliation of being ordered out of the room, and the courage it took to speak up anyway. But most of all, I remember the satisfaction of knowing that I had made the right choice, that my knowledge and training had saved a life, and that sometimes the best revenge is simply being excellent at what you do. So the next time someone tells you that you're too new, too inexperienced, or too cautious, remember this story. Remember that fresh knowledge is valuable, that careful attention to protocol can save lives, and that the courage to speak up when it matters most is one of the most important skills you can develop. But let me tell you about what happened in the months that followed, because the real impact of that day in OR 3 extended far beyond just one patient, one surgeon, and one nurse. The ripple effects of that moment of courage spread throughout the entire hospital system, creating changes that are still being felt today. 3 weeks after the incident with Mr. Chen, I was called into the office of Dr. Patricia Williams, the chief of surgery. I had never met her before, but I knew her reputation as a no-nonsense administrator who had transformed the surgical department's safety record over the past decade. When her assistant called to schedule the meeting, I spent sleepless nights wondering if I was about to be disciplined for my actions in the OR. Dr. Williams' office was impressive, lined with medical journals, awards, and photographs of her with various medical dignitaries. She was a woman in her early 60s, with silver hair and sharp eyes that seemed to see everything. When I entered, she gestured for me to sit across from her desk. "Nurse Sarah," she began, her voice measured and professional. "I've been hearing some interesting stories about your work with Dr. Hayes. I've also been reviewing the incident reports from that Friday morning procedure." My heart sank. I was certain that I was about to be reprimanded for insubordination, for challenging a senior surgeon, for creating what could be seen as a disruptive situation in the OR, but Dr. Williams' next words surprised me completely. "What you did that day represents exactly the kind of clinical judgment and patient advocacy that we want to see from every member of our surgical team," she continued. "You identified a life-threatening complication that could have been missed, and you had the courage to speak up despite significant pressure to remain silent." She leaned forward in her chair, her expression becoming more intense. "I want to ask you about something. We've been discussing the implementation of a new safety protocol here at St. Mary's, something we're calling the Stop the Line initiative. It's based on manufacturing safety principles, where any team member can halt a procedure if they identify a potential safety issue. The concept was fascinating and somewhat revolutionary for a hospital setting. In manufacturing, assembly line workers had been given the authority to stop production if they noticed defects or safety concerns, regardless of their position in the company hierarchy. The idea was that the person closest to the work often had the best perspective on potential problems. "We want to pilot this program in our surgical departments," Dr. Williams explained, "and we'd like you to be part of the development team. Your experience with Dr. Hayes has shown us exactly why this kind of program is necessary, and your clinical judgment has proven that new staff members can provide valuable insights that save lives." I was stunned. Instead of being disciplined, I was being asked to help develop hospital policy. Instead of being seen as a troublemaker, I was being recognized as someone who could contribute to improving patient safety across the entire system. Over the following months, I worked with a multidisciplinary team to develop the Stop the Line protocols. We studied similar programs in other industries, consulted with patient safety experts, and created training materials that would help staff members understand when and how to use this new authority. The program launched 6 months later with a hospital-wide training initiative. Every employee, from surgeons to housekeeping staff, learned about the importance of speaking up when they noticed potential safety issues. The message was clear. Patient safety was everyone's responsibility, and hierarchy should never prevent someone from advocating for a patient. Dr. Hayes became one of the program's strongest advocates. He shared his experience from that day in OR 3, talking openly about how his ego had nearly cost a patient's life and how a novice nurse's fresh perspective had saved the day. His willingness to be vulnerable, to admit his mistakes, and to learn from them made him a powerful spokesperson for the cultural change we were trying to create. But the impact extended beyond just our hospital. The Stop the Line program at St. Mary's became a model for other hospitals across the region. Medical journals published articles about our approach, and I was invited to speak at conferences about the importance of empowering all staff members to advocate for patient safety. During one of these conferences, I met Dr. Robert Martinez, a surgeon from Chicago who had experienced a similar incident in his own OR. A surgical technician had noticed a potential problem during a procedure, but had been afraid to speak up because of the hierarchical culture in their hospital. The patient had suffered complications that could have been prevented if the technician had felt empowered to voice their concerns. "Your story gives me hope," Dr. Martinez told me after my presentation. "It shows that we can change these toxic cultures, that we can create environments where everyone feels safe to speak up for patients." He went on to implement a similar program in his hospital, and we stayed in touch as both of our initiatives evolved and expanded. The network of hospitals using these patient safety protocols grew steadily, creating a movement that was transforming medical culture across the country. But perhaps the most meaningful impact was on the individual level, with the staff members who felt empowered to use their voices in ways they never had before. I received letters and emails from nurses, technicians, residents, and even housekeeping staff who had used the Stop the Line protocols to prevent potential problems. One particularly moving letter came from a nursing assistant named Maria, who had noticed that a patient's IV line was showing signs of infiltration during a night shift. In the past, she might have hesitated to interrupt the busy nurse, or might have worried about being seen as overstepping her bounds. But with the new protocols in place, she immediately reported her concerns, and the patient was treated before suffering any complications. "I kept thinking about your story," Maria wrote, "about how you had the courage to speak up even when it was scary. It gave me the confidence to trust my observations and advocate for my patient." These stories kept coming, dozens of them, each one representing a moment when someone chose to speak up instead of staying silent, when patient safety triumphed over hierarchy and fear. The program was working, but more importantly, it was changing lives. 2 years after that day in OR3, I was promoted to the position of Clinical Safety Coordinator, a role that had been created specifically to oversee the Stop the Line program and other patient safety initiatives. It was a position that allowed me to continue working clinically while also helping to shape policy and culture across the hospital system. Dr. Hayes and I continued to work together regularly, and our professional relationship had evolved into something truly special. He had become not just a colleague, but a mentor and advocate who helped me navigate the complex world of hospital administration and policy development. One day, as we were reviewing a particularly complex case, Hayes looked at me with a thoughtful expression. "You know, Sarah, I've been thinking about that day 2 years ago, and I realized something important. You didn't just save Mr. Chen's life that day. You saved mine too." I looked at him questioningly, not understanding what he meant. "Before that day, I was becoming someone I didn't recognize," he continued. "I was so focused on maintaining my reputation, on being seen as the expert, that I had lost sight of why I became a doctor in the first place. Your willingness to challenge me, to risk your own comfort for the sake of a patient, reminded me of what really matters." He paused, seeming to gather his thoughts. I was heading down a path that would have eventually led to a major mistake, maybe even a patient death. Your intervention that day didn't just save one patient. It changed the trajectory of my entire career and probably prevented future tragedies. It was a profound moment of recognition, one that helped me understand the true scope of what had happened that day. The immediate impact had been saving Mr. Chen's life, but the long-term impact had been much broader, affecting not just Dr. Hayes, but the entire culture of our hospital and eventually hospitals across the country. The revenge aspect of this story had evolved into something much more meaningful than simple vindication. It had become a force for positive change, a catalyst for improvement that was still creating ripples years later. The best revenge, I had learned, wasn't about proving someone wrong or getting back at them for their treatment of you. The best revenge was becoming so good at what you do, so committed to your principles, that you inspire others to be better too. As I write this story now, 5 years after that day in OR3, I'm serving as the Director of Patient Safety for a network of hospitals across 3 states. The Stop the Line program has been implemented in over 50 hospitals, and we've documented thousands of incidents where staff members have used these protocols to prevent potential complications. But the most satisfying part of my role isn't the policy development or the conference presentations or the research publications. It's the individual moments when I meet with staff members who have found the courage to speak up, who have trusted their knowledge and advocated for their patients, who have learned that their voice matters regardless of their position or experience level. Last month, I received a call from a first-year resident who had used the Stop the Line protocol to question a senior attending physician about a medication dosage. The resident had noticed that the prescribed dose seemed too high for the patient's weight and kidney function, but had been afraid to speak up because of the hierarchical culture in their hospital. "I remembered your story," the resident told me, "about how you had the courage to challenge Dr. Hayes even though you were just a new nurse. It gave me the strength to trust my calculations and speak up for my patient." The attending physician had initially been annoyed by the interruption, but when they double-checked the calculations, they realized that the resident was correct. The original dose would have been potentially toxic for that particular patient. A medication error was prevented, and the patient received appropriate treatment. "Thank you for showing us that it's not about hierarchy or experience," the resident continued. "It's about patient safety and having the courage to do what's right." These conversations happen regularly now, and each one reminds me of why that day in OR3 was so important. It wasn't just about one patient or one surgeon or one nurse. It was about creating a culture where everyone feels empowered to use their knowledge and voice to advocate for patients. The story has also had an impact on medical education. Several nursing schools and medical schools now use the case study of that day in OR3 as part of their curriculum on professional communication and patient advocacy. Students learn about the importance of speaking up, about how fresh perspectives can be valuable, and about how to navigate challenging situations with senior colleagues. I've been invited to speak at graduation ceremonies, where I share this story with new nurses and doctors who are about to enter the profession. The message is always the same: trust your training, follow your instincts, and never be afraid to advocate for your patients, even when it's uncomfortable or scary. One of the most rewarding aspects of this journey has been seeing how the story has inspired others to share their own experiences. I've received hundreds of letters and emails from healthcare workers who have had similar moments of courage, who have spoken up when it mattered, who have chosen patient safety over personal comfort. These stories create a powerful narrative about the importance of empowering every member of the healthcare team. They show that great care comes not from individual heroics, but from teams where everyone feels valued, heard, and empowered to contribute their expertise. The relationship between Dr. Hayes and me has continued to evolve over the years. He's become one of my strongest supporters and advocates, and we've co-authored several papers on communication and teamwork in high-stress medical environments. Our story has become a case study in how conflict can be transformed into collaboration when both parties are willing to learn and grow. But perhaps the most important outcome is the impact on patient care. The hospitals that have implemented these safety protocols have seen measurable improvements in patient outcomes, reductions in medical errors, and increases in staff satisfaction. The culture change that began with one moment of courage in one operating room has created systemic improvements that benefit thousands of patients every year. This is the real revenge of competence over arrogance. Not just the satisfaction of being right in one moment, but the long-term impact of staying true to your principles and inspiring others to do the same. It's the revenge of creating positive change that extends far beyond your own experience and touches the lives of countless people you may never meet. And if you've made it this far in this incredible story of medical justice, don't forget to subscribe to Hospital Revenge, smash that like button, and share this video with anyone who needs to hear that their knowledge and perspective matter. Leave a comment telling us about your own experiences with standing up for what's right, and let's build a community of professionals who believe that competence and courage can overcome any obstacle. Until next time, keep fighting the good fight, and remember, the best revenge is being so good at what you do that nobody can ignore you.